on with the clinical impacts of lupus. Causes and risk factors. There's really no definitive cause. Science does tell us that a family history of autoimmune disease can predispose individuals to lupus. Triggers of symptoms can include sunlight, infection, and antibiotics, anti-seizure medications, and blood pressure medications. It is more common among women, ages 15 to 45-year-olds, and it is more common in African Americans, Hispanic, and Asian Americans. There is no one test that can diagnose lupus. Rather, it's sleuthing around to rule out what it might not be. Lupus does have overlapping symptoms with a lot of other conditions. Blood tests can be helpful. Things like an anti-nuclear antibody test can show if the autoimmune if the immune system is attacking healthy tissue. Complete blood counts, which would include the red blood cell, white blood cell, and platelet count. Urine analysis can be helpful to see if there's the presence of red blood cells and also to see if there could be kidney complications. Biopsies, in which a physician would make an incision and remove some tissue to see if there's inflammation of the tissue, can be helpful. Imaging, like a chest x-ray to see inflammation of the lungs, as well as echocardiograms to look at the health of the heart and see if there's inflammation of the heart. Lupus has an impact on a wide range of body systems, including kidneys, brain and central nervous system, blood and blood vessels, cardiovascular system, and the respiratory system. Things would include endocarditis, which could lead to stroke, pulmonary hypertension, pleural effusion or fluid leaking from the pleural cavity, just to name a few. All of these things can be life-threatening and fatal. Treatment and prognosis includes non-steroidal anti-inflammatory drugs, anti-malarial drugs, steroids, biologics, antidepressants. Vitamin D and the use of sunscreen can help prevent triggering of especially the rash. But there is truly no one cure. Rather, there are just ways to improve the signs and symptoms. So they're very much based upon an individual and case-by-case situation. 80 to 90% of patients can have a normal lifespan, but it's very important for patients to follow physician's advice and regularly take the right medications.